Hi, my name's Julianne, and today I'm going to talk to you about care after you've been discharged home from the hospital with a coronary artery stent. I'm going to discuss in this video a little bit about what a coronary artery stent is, the procedure that you endured to receive this stent, a little bit about your heart and how it functions, risk factors in reducing your risk, medications, exercise, diet, and of course I am going to post a couple links below on some videos that I found. First, you are the new owner of a cardiac stent, so that comes with a card which the doctors would prefer you carry around with you at all times in your wallet, so they are aware of where the stent is and how many you have. Now, one of two reasons you may have received the stent is the first reason is that you were having chest pain, went to the emergency room, they did an EKG, found that you were having a heart attack. A heart attack is a complete occlusion of one of your coronary arteries in your heart. Now, they do a procedure called a cardiac catheterization, which is they take a guide wire, and they insert it through your wrist or your groin, it is physician preference, and they insert this guide wire, which goes all the way to your heart, and they inject some dye. Now, what the dye does is it shows where the blockages are in the coronary arteries, so the doctor can place a stent in the proper place. Second reason, you may have had a procedure called a outpatient cardiac cath, meaning your doctor wanted to check your heart because you were having some chest pain on exertion, meaning exertion that you were exercising or moving around and the pain got worse. So you had this procedure done, you came in the morning, had the procedure done. They found out that you had a impending blockage, meaning the coronary artery wasn't completely occluded, but it was in the process of getting very close to occluding. So they placed a stent so that wouldn't happen. Now, when you're discharged from the hospital, our hospital gives discharge sheets. Okay, each hospital is different. You may get a packet, a video, or just a paper. Okay, I'm going to show you a picture of your heart. This is an anatomical drawing. These things right here, this right there, and then this big one that runs there. There's also one that goes down the back of your heart. Those are your coronary arteries. Your heart is a muscle, and in order for it to function, it needs blood supply. So therefore, the coronary arteries provide blood flow to the heart for it to function. Now, when they're blocked or occluded, it makes the heart work harder. Therefore, it causes chest pain. When it's completely occluded, it causes severe pain, and it can lead to damage if it's not reopened and the blood supply isn't returned back to the heart. Now, I'm going to talk a little bit about risk factors people are at for a heart attack. First being family history, which is the most prevalent thing sometimes, and one thing you cannot control. Next thing I'm going to talk about is controllable risk factors, that being your exercise, your diet, and of course smoking. Every doctor or cardiologist will recommend that you don't smoke. And a diet that should be followed is a heart healthy diet, meaning low fat, low salt, high in fruits and vegetables. Now, the American Heart Association has a website with some great tips and recipes on diet you can follow to help maintain a heart-healthy life. Now, exercise is recommended. Our discharge instructions from our hospital recommend exercise 30 minutes 3 times a week. Now, after you've been discharged from the hospital, they're going to want you to take it easy for a little bit, meaning start maybe 30 minutes once a week and start to work your way up to that 3 times a week because you don't want to exert yourself too quickly. The next thing I'm going to talk about is medications that you're going to be discharged with. Now, you're going to be on a bunch of new medications, maybe not a bunch, but a few. The first being an aspirin. Now, it may be a baby aspirin, which is 81 milligrams, or a full-strength aspirin, which is 325. And you may also be on, but not, limited to a beta blocker, a nitrate, a calcium channel blocker, a statin, an ACE inhibitor, and another blood thinner, either Plavix, Effient, or otherwise specified by your doctor. Now, we recommend you take these medications as prescribed and to follow up with your doctor for regular visits. Now, the next thing I want to talk about is signs and symptoms of an impending cardiac problem. The biggest thing is substernal chest pain. Now, everybody doesn't have substernal chest pain. You may have arm pain on one side or the other, pain into the neck or the jaw, or pain that goes across the back, or sometimes in the epigastric region or in the upper stomach region. We want you to immediately contact your doctor or call 911 or proceed to your nearest emergency room if you are having these symptoms and have had a cardiac stent. And last but not least, I want to talk to you a little bit about a video that I'm going to post which shows a cardiac cath procedure as narrated by a cardiac doctor who did the procedure. So in conclusion, I want to talk to you about, make sure you manage your medications, take them as directed, exercise on a regular basis, a low-fat, low-salt diet, and to make regular visits with your doctor. I thank you for your time. Have a great night.